So the anecdote I'd like to share is a reminder of how important it is to keep the patient at the center of care and keep their wishes and needs as part of the real patient experience we're trying to create. This incident made a real impact on me. My mother-in-law is 95, will be 96 in a couple months. But 4 years ago, I got that call in the middle of the night that you never want to get. My wife was visiting her at the time about 5 hours from our home, and my wife called and said that her mom had been taken to the emergency room and said that she had been diagnosed as having sepsis. Well, as a physician, knowing what the odds were at that point, I expected the worst. And so I went, and the next morning I drove. I included a dark suit because I thought that we were likely to be dealing with a situation like that. Well, the great thing is that this hospital did everything right. They delivered incredible technical care. They did every piece of that sepsis protocol exactly how it's supposed to be. And my mother-in-law, in fact, was out of the ICU and on the floor within 36 hours. So remarkable recovery. And by the way, my mother-in-law is a remarkable woman. 6 children, 13 grandchildren. I really enjoy her, and she's doing well today. And then I watched over the next several days, because she wasn't quite ready to go home, some of the dysfunction that was in the system. Things like a different hospitalist came to see her every day. And it was always different explanations about what might be happening or what the next step were. Never quite got the medications exactly right. And the one thing that she was most concerned about, which is, am I going to be able to go home? Am I going to have to go to rehab? Sort of what's the next step for me? No one was actively able to address until the final day. And I watched the anxiety and distress that created with her, and the confusion on the part of my wife's family, who were sort of asking, why is it that we can't get simple answers or straight answers to some things which are important to us? And so that it just was a real reminder to me, and something I reflect on, that although we may deliver excellent technical care, that empathy, that understanding sort of what's important to the patient and building that care on them is so important. And that interdependency that we talk about safe, high quality, patient-centered care, patients really are asking for all three things. They hope that we can deliver that 100% of the time. And this incident reminds me of that. I reflect on it weekly and monthly, because as a physician and a clinician, it really is a reminder that it's all the pieces we need to put together for our patients. Because continuity is so important, and consistency, I think, is what patients are looking for. What I took away from it, and this is an issue at many hospitals, for example, is I think the schedules are built around the caregivers as opposed to the patients, and unless there's a premium placed on that communication so that the story doesn't vary from day to day, you can fall into sort of traps where each individual physician, well-meaning physician, sometimes each shift of nurses, all very well-meaning, well-educated, trying to do the right thing. If they don't communicate well, then it can come across as disjointed. And so this idea of communication is key, not only for safety and quality, but for the patient experience that we're after. Working as a team, these are things which are all very important to our patients. And I think you can get continuity without having to make the schedule a certain way, but you have to value it first.